to talk to you about frozen shoulder and some of the best exercises for it. The first part of this video is going to be a brief overview of frozen shoulder and what it is and some information about the different stages. And the second part is going to be exercises and which ones are most appropriate for each stage of frozen shoulder. If you want to skip straight to the exercises, you can skip to the timestamp listed above. But first, here's some information. Disclaimer, this video is not medical advice. It is strictly for educational purposes. It is not intended for use of self-diagnosis, and it does not create a patient-physical therapist relationship. If you are experiencing any symptoms similar to the ones in this video, you should contact your primary care provider immediately and set up an evaluation to move forward with the best form of treatment for your individual condition. So frozen shoulder or adhesive capsulitis is abnormal thickening of the shoulder capsule and development of dense adhesions that restrict range of motion, causing pain and difficulty with overhead reaching movements. Some common factors of frozen shoulder are being a woman ages 45 to 60, patients who have diabetes, especially type 2 diabetes, being a heavy smoker, and different types of thyroid problems. It can also be someone who's sustained a recent injury to that shoulder. However, it often presents as what we call insidious onset. So this means that there's no known cause or viable reason for the appearance of frozen shoulder. The characteristic symptom of frozen shoulder is loss of range of motion in what's called a capsular pattern. This is just a movement pattern. In the case of frozen shoulder, it's going to be external rotation, abduction, and internal rotation. So this will cause difficulty if you're reaching back to wash your hair, or reaching back to unhook your bra strap, reaching overhead, things like that you might be having trouble with. Let's move into the different stages of frozen shoulder. Stage 1. This is going to last approximately 3 months. This is gradual onset of pain that's worse with movement. You'll have normal strength in the shoulder with restricted range of motion, especially in external rotation. And pain that's worse at night, this is the most characteristic symptom of this stage. Stage 2, this is the freezing stage. This can last 3 to 9 months after initial onset. This is characterized by unrelenting pain at rest, limited motion in all directions, and minimal effect from things like corticosteroid injections. Stages 1 and 2, we don't want to be doing anything like weighted exercises or anything that's going to inflame the shoulder anymore. We just want to be doing light stretching to try and maintain all the range of motion that we have so far and try to prevent any more loss of range of motion. Moving into stages 3 and 4. Stage 3 is the frozen stage. This is where we can really begin to work on the shoulder a lot more. You're going to have limited joint motion, often weakness in the rotator cuff from not using it as much, and significant adhesions present. So in this stage, we can do some resistance exercises and a lot of stretching trying to get that motion back. Stage 4 is the thawing stage. So you're going to have minimal pain and swelling, but significant restriction from those adhesions that have formed, and your motion will gradually improve over time. Inappropriately aggressive therapy at the wrong time can actually worsen symptoms and prolong your recovery time. So I really want to stress that if you're experiencing these type of symptoms, you should make an appointment to see a medical professional in person for an evaluation. These exercises in particular are for stages 1 and 2 of frozen shoulder. In these stages, we really want to be gentle with the shoulder. We're focusing on gentle stretching and maintaining range of motion. First stretch that I'm going to give you, I'm going to do these in standing. These are super easy. We're just going to take your nice broom handle, say that this is my frozen shoulder, right? This is the painful one. We want an underhand grip here. So I'm using this arm, the good one, to kind of control what I do with the other one. So I don't want you using any muscle in this stage. We're just trying to get motion and stretching in that arm. And if your arm during these exercises doesn't go as far as mine, that's totally okay. No pushing through pain in these stages, just do what's comfortable in your own body. This is the first one. As you can see, I'm just focusing on my arm going in and out. If you like, you can tuck a towel underneath here, like this. And we're just gonna go back and forth, Nice and slow and easy. And if we're starting here, back, forth, when we start at the beginning, that's going to be 1. I would recommend starting with 10 of those. Try 10 in the morning and 10 at night. See how you feel the day after. And if it feels okay, do 10 in the morning and 10 at night. And that's it. Next one, you're going to put one arm at each end of the broom, and this time we're going to go into abduction. So that arm goes out. Remember, it's this one, right? That's the hurt one. So same thing, 10 of these, just stretching, using this arm to stretch this hurt arm up as far as you comfortably can. And we'll just do 10 of these. Again, nice and slow and controlled movements. You see how I'm not using my muscles to lift my arm. All the muscle use is in this hand. This is just gentle stretching. Finally, we're going to go forward. So this way. So rather than our arm going out to the side, now it's going out straight in front of us. Easy, gentle movements back and forth. Just try 10 of these to start out with. I would recommend kind of going to the end range even. So if it starts to hurt right here, hold and push just a little bit farther, but we don't want to be pushing through pain. Our main goal here is just to maintain as much range of motion as we can without irritating that shoulder joint. Next, we're going to do what's called a pendulum. So you're going to take a weight. This is my weight. This is probably 1 or 2 pounds. You're going to stand, let your arm hang, and just use your body weight to swing it around. You're using your hand to hold the weight, but you're not using any shoulder muscles to move your arm around. You can stand over to the side, whatever's comfortable for you. And if you are going to bend over, make sure that you have good form in your back. I like to use a table, my imaginary table here. Try 10 in one direction, 10 in another direction. The final one is going to be arm slides. So ideally you would be doing these at a table. This is going to be my table. You would be seated in a chair at a table. This is my injured arm, right? And so you're going to take a towel, put your arm in the towel, okay? And then use the strong arm to push your arm forward. So we're just moving back and forth, not using any muscle in that arm, but sliding it back and forth on the table. So you're getting that up and down movement of the shoulder joint as you slide without using any muscle. You'll just go back and forth. If you want to hold at the end for a little extra stretch, you can do that. We're not stretching through pain or doing anything that will inflame or irritate the shoulder in this stage. Heat or ice can also be really helpful. Whichever feels better in your body, that's the one that you should use. Those are my best exercises for stages 1 and 2 of frozen shoulder as a physical therapist. These are going to be exercises for stage 3 and 4 of frozen shoulder. If you want more information about these stages, you can click to earlier in the video. But brief overview, in these stages, you're going to want to build back muscle and regain range of motion, and it should be a lot less painful than it was in the earlier stages. We're going to start with some standing exercises. The next exercise is for range of motion, so we're going to do arm flexion and external and internal rotation. So you're going to go up like this, over to one side, to the other side, and back down, and that's one with 10 of those. So just up, one side, come back to the other side, make sure you're remembering to breathe, and come back down. And again, in this stage, we really don't want to do anything that gives us sharp pain. If you feel a stretching sensation, that's fine. If there's some cracking and popping in your shoulder, that's fine too. But what I don't want is sharp pain or for your shoulder to be sore for 2 or 3 days after we do these. The pain and the movement should be getting better at this point. Again, I would try about 10 of these. Another really popular one is passing behind the back. I just have a coffee mug here. It probably weighs 1 to 2 pounds. And then I start on the right side, pass it behind my head, grab it, bring it out, reach back, pass it again. Another range of motion exercise that you can do, use a towel. So using your body weight to press into the towel, stretch your arm up, and coming back down. And you see how I'm leaning my body forward to raise my arm up. And forward, and back down. Just like that. Next, we're gonna do what's called isometric holds. So you are gonna wanna grab a small towel for this one. We're gonna say that this is the injured arm now, right? You want the towel tucked right in your armpit. Your arm is at 90 degrees. And the first one, we're gonna focus on external rotation, since that's where we lose the most motion a lot of the time. We'll take the back of our hand and press into the wall. I'm pressing as hard as I can into the wall for 5 seconds and relax. And then press 2, 3, 4, 5 and relax. And as I'm doing these, you see how my posture also stays good. My feet are apart. I'm standing upright, straight, looking forward. You know, I think one of the biggest mistakes that people make is they're looking down. Try to keep your spine aligned and stand straight up. We're focusing on the shoulder, but we don't want to forget about the rest of the body either. Pressing this arm into the wall, 3, 4, 5, and relax. Try 10. You'll do these in different directions the first day. See, I'm gonna do extension now. I'm pressing my elbow back into the wall, 4, 3, 2, 1 for 5 seconds. And then I would do 10 of those 5-second holds, 3, 4, 5, and relax. We go from external rotation to abduction. So one motion is I'm resisting this, and the next motion, I'm resisting this movement. So I'm gonna put my elbow on the wall, right? And then press my elbow into the wall. 1, 2, 3, 4, 5, and relax. Those are what's called isometric holds. Those are an easy way to build strength early on after you've lost a lot of strength in your shoulder. You want to try those and then see how you feel after the first day. If it's really painful, then you're going to want to go down. You can try doing less or holding for a shorter amount of time. What we don't want is sharp pain or pain that lasts a long time. Start recognizing what kind of pain is good in your body too. You know, if you're building muscle and it's sore from building muscle, that's good. But if your joint, if it's hard to move your shoulder joint, then that's bad. This is the last type of exercise, so it's called gravity resisted, and I would recommend just lying in a comfortable position, right? This is my weight, 1 or 2 pounds is what you're gonna start out with. I would recommend really starting out with nothing, and you're just gonna do external rotation, 2, and just do 10 of these, right? If that's super easy, try a 1 pound weight. But because this isn't a muscle group for most people that's used a lot, a 1 pound weight is pretty good. You know, 10 of these with a 1 pound weight, that's fine. I'll have you do 10 of these and then just go in all directions with that 1 pound weight. 10 of those in external rotation, side lying. You're gonna do 10 in flexion. Just like that. Just assume that this is the hurt arm, right? So 1, 2, 3. Nice, slow and controlled movements. And we're keeping our posture good, the rest of our body upright. You can do these in standing or sitting. And that's it. Pick a couple of those exercises that you like and just do those. 10 in the morning and 10 at night. Don't forget to do the holds. Those are my best exercises for frozen shoulder as a physical therapist. If you'd like more, I have another video that you can check out for shoulder and neck pain. Those have some similar stretches and exercises if you'd like to check that out. And if this video was helpful to you, please like, comment, and share. It really helps me out. I hope that you got something out of this video. And thanks for watching. Stay healthy, everybody.